the risk and the severity of the dengue situation is apparently rearing its head at a little rapid rate. We have noticed as the rain started from our surveillance unit that the number of dengue fever cases reporting to our hospitals and also being reported and having been increasing quite dramatically. We also, unfortunately, would like to say that we have recorded one death in the month of June, and we confirmed that death. So we felt it was very critical as we're seeing this rapid increase that we come to the public with the information to step up. And I want you to take note of the fact that we said we want you to step up our response, because we have a continuing response to the question of the elimination of the Aedes aegypti, but we are increasing that response. Now, the other factor that we want the public to take note of is that Aedes aegypti and the question of dengue fever and dengue hemorrhagic has been with us for the last 35 years, and it comes in cycles. But we have noticed, not only in Trinidad and Tobago, but globally, with climate change and the increasing temperatures, the cycle of 5 years is decreasing, because I don't know how many of you remember, but just 2 years ago, we also had a severe problem. So within 2 years, we are now looking and we're hoping that the graph doesn't continue, and that is why we want the help of the public. So within 2 years, we are seeing a trend upwards at a rapid rate. So the question of every 5 years is really not on. The other point that the Minister of Health wanted me to make sure that I say to the general public was we have 4 different viral types that cause dengue. When you get dengue once, it does not protect you from the second viral type, dengue 1, 2, 3, 4. The more often you get dengue, the likelihood that you will get complications with the dengue hemorrhagic fever and leading on to shock and possibly death increases. So if you remember my statement that said that Trinidad and Tobago have been having dengue over the last 30 years, it means that the population numbers who have been infected over the last 30 years have repeated infections have increased. We saw evidence of that in 2008, where the number of people who got dengue and those who got complications, especially the children, a high proportion of the children who got infected ended up in our hospitals with dengue hemorrhagic shock and dengue hemorrhagic fever. So the point I want to make, it does not take many cases for us to have dengue deaths again because of the nature of what we are facing. So it is extremely important for us to eliminate and control Aedes aegypti, report to the hospital or your doctor as soon as you perceive that you have dengue fever, especially if you know that you have had it before, especially with the children.